Hello, my name is Calvin. I'm 25 years old. I live in the Seattle area, and I have Wilson's disease. I'm currently taking a medication called Trientine to manage my Wilson's disease. My doctor has prescribed 6 pills a day, with 3 pills in the morning and 3 at night. Additionally, I must keep to a strict intermittent fasting routine because of my medication. For 2 hours before and 1 hour after taking the pills, I can't eat anything, so that's a minimum of 6 hours a day that revolves around my medication timing. There are many difficulties that come with proper treatment. My medication needs to be refrigerated at all times, so travel can be cumbersome. I also have to be careful about my water intake, using filtered or alkaline water because regular tap water contains trace amounts of copper from the pipes. I've even had to drop certain treatments due to it just being too difficult to maintain. I used to take zinc tablets, but it was just too difficult to constantly manage both medications, so my doctor decided to focus on just Trientine for now. I was first diagnosed at 21, and at the time I had tremors so severe that I could barely use a screwdriver or type on a keyboard. Basically anything requiring fine motor skills was extremely difficult. The tremors also contributed to my depression, though I didn't recognize it as depression for a long time because I thought I just had a melancholic personality. Now, at 25, my symptoms are more manageable. The tremors have reduced to almost nothing because of my medication, and I still get a small tremor if I go too long without it, but it's minimal. Often the reason I go without medication is because the program that supplies an affordable option is cumbersome to navigate, but occasionally I do forget to take my medication because I have ADHD. My other symptoms of depression has lifted thanks to my medication and some therapy, but I still do struggle with anxiety, though it's hard to tell what's directly related to Wilson's disease versus other factors. But the medication has been transformative for my quality of life. When I was first diagnosed, my Wilson's had gotten so bad that I lost my job because of the tremors and mental distress. I now work at Delta Airlines, which is a job that requires physical strength and mental fortitude. This would not have been possible before, not just for the physical limitations, but also my confidence levels. The treatment gives me peace of mind when I see my test results showing that I'm making progress internally and that I'm not at risk of adverse health situations anymore. Since my tremors have subsided, the only way I can tell that I'm making progress is through my doctor's appointments. Seeing the trends of my invisible symptoms go up and down gives me a clear path on what my next action should be. If I did not have my doctor's appointments, I would have no idea what I needed to do to manage my Wilson's. The medication is not ideal, but short of a complete cure, I would want a medication that requires less time management. Even if I could reduce the eating restrictions to be only just 1 hour before and 1 hour after, that would be a significant improvement. Although ideally, I'd love a once daily medication instead of twice daily, and I would like to be able to store it at room temperature, and I would like to take it with food. Just having all those things taken off would be a tremendous help in minimizing the headspace it takes up. One of the ongoing challenges of having Wilson's disease is not knowing what aspects of my personality and behavior are related to it versus it just being me. I have low impulse control, and I wonder how much of that is disease related. I had a great uncle with Wilson's disease from before it was well understood, and he had speech problems, severe tremors, and made some questionable decisions that seemed to affect his judgment. The mental health aspects are particularly unclear. Many patients struggle with depression and anxiety, but doctors can't definitively say whether it's linked to Wilson's disease or not. That uncertainty can be frustrating because it means that science isn't yet there to provide clear answers about what to expect and how to address these symptoms specifically. It also makes me wonder about long-term effects of what the future holds, especially since there isn't much guidance on how treatments might need to change over time. Thank you for listening. That was my testimony.